Hello, friends. A very good morning to all of you out there. Thank you very much for joining in. We can understand how stressful it is days before exam. They are full of anxiety, stress, and we are here to relieve your anxiety and give you some last minute tips so that we can do the boosting and you all can bring up the best. Hello, my dear mentors. Hi, Chin. Hi, Tamina. How are you guys doing? Good
Good morning.
morning.
Good morning from
Good
my side.
morning.
Good
Well,
morning.
good morning,
Thank you
every
so much. How's your health, Chin?
all good. Thank you very
Oh,
much.
that's good. The voice seems to be better now. Yeah.
Yes.
Hello, Tehmina. How are you doing, my dear?
Hello. Hi.
Hi.
I'm
I hope you're
fine.
fine. That's great,
Yeah.
my dear. So students are ready once again to
Hmm.
just big show on exam. Hi, Priyanka. Hello. Hello, Rabia. Hi, Amira. Thank you very much, Shima, for joining in. And all those who'll be listening to the recording. We are here to give you some last minute tips. But before that, tell me what is disturbing you guys. Any sort of last minute queries which you guys have. Amira, Priyanka, Rabia, anything as the last minute which is like disturbing you guys, or you people want that this needs to be clarified in terms of your dress codes, in terms of your, how many of you are on Friday? Amira, you're on Saturday, right? Priyanka, you're on Friday?
Doctor, I'm
Yes.
on Saturday actually. Saturday.
Amira
Myself
is
on
also on
Saturday.
Saturday. Yeah,
Yes.
Rabia, you? Rabia, you're on
Yes,
Friday?
Dr. Sidra. No, Friday. No, I'm
Okay.
Saturday.
You're also Saturday. Shima,
Yes.
you? Anybody on Friday out of you guys? Okay, all are on Saturday. Okay, I think Friday people have not. Inas is on Friday. She's not joined. Yeah, Temina, do write for others. Please join in that we are doing some last minute tips that would definitely be helping you guys for the booster. All right. So you all have first the long case correct? All of you? Yes, as per the email, yeah, which we discussed.
Yes, ma'am. They said
Yes.
first.
So it's yeah, so long case first. Just do a quick outline of the long case Tamina for them, that what do they need to remember, their attire and everything, some last minute tips from Tamina and then Chin, and I'll just do the quick recap of it. Quickly, Tamina. Yes, my dear, for them.
Hello. How are you all? I think all are fine.
Yes.
Relax because it no need to stress. Already you know everything, and trust on you and trust on Allah. Everything will be okay. So about long case, I already mentioned and also discussed last session also. Just here only 25 minutes, and there is a mannequin, there is a one role player and two examiner. So you have to take history from the role player, then examiner will tell you to do examination, and you have to do examination of the mannequin. So sometime it will be full or half, just only abdomen or thigh that is remains. So these things you are more worried about, that how you will do examination, what will be the mannequin is full or half. So it will up to the examiner or exam center, what they can provide. So after that, yeah, if you do examination as it is mannequin, you have to mention the important points, what the case you get from that role player, that what the topics, what is the case. According to, you have to just mention the what examination finding you will get. After that, examiner will lead you where to go, what to do. So don't
Yeah, I
worry
mean,
that
here the students are asking that, see, both ways it can be. Like after history, do they need to summarize first or they'll go to the examination? I think it depends upon the examiner only. They said,
yeah,
okay,
this is
summarize.
also depend on the examiner. Sometimes some examiner tell, okay, after examining, after taking history, they tell, okay, tell the summary. Most of the
Exactly.
time they told like this, that they tell the summary. That time
Hmm.
you have to mention the must, you have, hello?
Yes, you're audible, my dear. Yeah.
Yes. So that time you have to tell that what the important things and what you just ask that things. Never added anything what you maybe you forget to ask. This is the important point in do the summary. Then when you do examination also, they also tell what examination findings you will get. That is also summary of the examination. And after that, sometimes examiner can tell that some breaking bad news, if there may be, examiner maybe told you how you will break the news to the patient. That time you have to tell the role player. Most of the cases, if it is not breaking bad news, it is just a normal case like obstetric cholestasis or like this. That time examiner will ask you more questions like a viva.
At times they can say
Some,
that, can you please explain this condition to the patient? So they want
yes,
to assess
sometimes,
your
yes,
communication in 2 minutes,
mhm,
if it's not a breaking bad news. So can you please
yes,
explain this condition to the patient? Then how would you
yeah.
counsel that what she has,
Yes. Also, sometimes, a few cases I listen that some question also role player asked to the candidates that okay, what will be my treatment? That time
Yeah.
you have to tell that role player, that time not tell in any must be told in
Jargons.
layman language,
Layman
not
language.
in the yes.
Yes.
But when you talk with the examiner, not in layman language, this is the,
Mm.
you think during stress time, you have to remind this thing yourself that how you will go. Just so
Absolutely.
for that reason, relax is very important. Just stress free. Any other question about long case?
Yeah, after that examination, then they have to summarize the examination, but you will not have the findings. If they give you, you can say that, okay, I'll check this,
Yes, yes,
and
yeah,
then the Viva would start. Yeah.
yes. Mhm.
So again, Amira was asking the other day, can we divide the timings into that? Because at times it's like, a prompt by this chain. Can we divide the timings into the long case?
Yeah, so basically, there is no stopwatch or clock that you can be, that will be directing or guiding you during the long case itself. So basically, the examiner will prompt you and say, no, are you done? Are you okay to proceed on? Or if they ask you a question or they pose you a question during the station, then that means that it's time to move on to the next section. So that will be kind of a guidance to you. So don't be worried, because you will.
Circuit, because it's fixed 10 minutes. So we say, okay, if it's a, simulated patient task, you'll take the history in 4 minutes and then you do that. Here, they might alter, like after you take a history, they would say, okay, can you please summarize? Then they'll prompt you if you think that you're taking more time, and then you please examine. And then at least 10 minutes, last 10 minutes, they keep for the Viva questions and, evaluate the topic. But that
Exactly.
varies. See, if the students, they take history examination and then they come to the, next examiner, but at times they're just like they just after the history they're simply comfortable with like telling and then communicating with the first examiner and then the second examiner for the Viva. So we can't fix the time, but generally how much time they should be organizing themselves for the history, Amina, for the long case. Yeah, I think around 5 minutes.
Around 6 minutes, 5 to 6
Yeah,
minutes,
5 to 6
because you have to take full history, not
full
tell the
history.
targeted history,
Exactly.
not
Yeah,
go for
HOPI should
targeted
be very
history.
elaborate. Hmm.
So another points also, if first of all, you just follow your steps, not do any haphazardly anything. That time what happened, if you go stepwise, examiner will, you if they saw that you are taking more time or you are going stepwise, they will stop you. They will tell, okay, next. They go for you next, like this, mostly in this case of examination, because we don't know how many minutes we can do the examination. Because history, we know 5 to 6 minutes, very rarely someone go to 7 minutes. But in examination, we don't know that how many times you have to spend. That time you say that if you go stepwise, that you will show that I first check patient safety, then I first check the first general examination, then you will go for abdominal examination. That means stepwise. That time when they saw that you are in step, you know the steps, if then they will stop you and they will tell, okay, do this, next. And also they will tell, they're very nice people. They will tell, yes, I know, just go next. That means it is very good points, very that you will be happy that time that they know that you know.
Absolutely, yes. So what she means to say is, friends, that if you're starting with the general physical examination, for example, if you're starting with the pulse and the blood pressure, you would say that I'm going to take. If they say, okay, just omit the general physical examination. All right. So then they're doing a prompt. Okay, you know it. But you have to go in a stepwise manner, including the lymph node palpation, even the thyroid, everything you have to speak as per the general physical examination. All right. Okay, so Chin, how to take the besties of those last 10 minutes, where the discussion is going on? What do you think we should be, just they say that Viva is actually leading the examiner, that you just throw some point where that discussion starts. So what would be your suggestion for the last few minutes of the long?
Basically, in the last few minutes, you mean during the discussion of the Viva?
Yeah, during the discussion, exactly, the second examiner, yeah.
Yeah. So basically, the second examiner has another set of questions to be asking you. So listen to the examiner, what he or she has to ask you, because these are in your scorecard, basically. And whatever that you, if let's say at the end of the discussion and you still have a few minutes there and you have already answered all the tick box, basically, then usually they will ask you like, is there anything to add on, or is there anything that you like to further discuss about that certain topic, like for example preeclampsia or hypertension in pregnancy, for example. So just think of what you think that you might have missed out in the history or the examination that you might want to add on, because there's no harm mentioning it, because for all you know, those are the things that you may have missed out earlier on. So you can just add and throw it in, basically.
Yeah, absolutely. Any questions from the long case, please? Anything which you guys have a questions? Noreen, happy to have you here, my dear. Have you reached back? Noreen, have you reached back?
Yes, Dr. Sudha, I'm in Saudi now.
Oh, that's perfect. How is mother, my dear?
Yeah, she's better now. Thank you.
Okay, lots of prayers, my dearest. Anything which you people want to ask regarding the long case? Are you guys clear about this? Anything which is disturbing you guys in the last moment? What you need to be is just like showing them your confidence and just go in a sequence like you approach. They would just want to see your approach towards the, a patient and how you actually approach the long case scenario. So ups and downs in between, if they stop you or something, and if they prompt you, don't get nervous, because they want to evaluate you on something else. That's why they're doing a prompt. All right. Okay. So about the circuit, see, I always tell you guys that one simulated patient task, be good in your time management. It can be an angry patient, like we do have the miswaps and stuff, it can be a breaking bad news like a cancer, any sort of it can be a maternal medicine case like the cardiac cases. Whatever is the case, I would request all of you to just be confident in your simulated patient task. You're going to get one, and introduce yourself in a confident manner. Keep on checking the understanding, please don't forget, and just do it chunks. So that's the best way in this. Regarding the structured discussions, if any question you do not know, it's fine. Few of the questions they just asked, like in primary amenorrhea, in Sewer syndrome, recall, they asked about some sort of a syndrome, like, Frazier syndrome or something. Students were saying, if any such question it comes, it's okay. Difficult is for everyone. So don't get nervous by that and don't get upset by this, because comparatively as compared to, Mrcpi Osce, they have a comfortable environment. I'm sure everybody would agree, because if you have been through that Osce, then this should not be a trouble. You just need your confidence in that situation, right? For structured discussions, please listen to the question very carefully. If they're asking something, for example, if they're asking, how would you treat, right? If they want to know the treatment, if they say management, yes, history, examination, investigation, that would be a part. When they say, how would you treat? So do not spend unnecessary time for something which is not part of the scorecard. So if you don't understand the question, you can ask, can you please rephrase that for me, right? Can you please repeat the question for me? So don't worry for this, because at the end of the day, your communication at that point matters. I'm sure you've gone through all the labor ward folder. If somebody has not gone through that, please today do that. So what's the outline of revision? Hello, Inas. Welcome to the session, my dearest. What are your plans for today and tomorrow, guys? Give us your plans so that we know that what are your plans for. Priyanka, Inas, you're on Friday, right? Yeah, rest everyone is there.
Yes,
Noreen,
I'm on Friday morning.
yeah, everybody else is on Saturday, correct? Noreen, you're also on Saturday?
Friday, doctor.
Okay, you are on Friday. Okay, my dearest. So, what is the plan for today and tomorrow? What is the revision plan so that we can guide you? Is this the fine plan?
Are you asking to me?
Yes, yes, my dear.
I'm
Because I
sorry
know
to
that.
tell you that I couldn't do anything. So just started from the long case. I'm doing
Okay,
the
good.
long cases because that is important in examination. Just want to repeat. And then
Okay.
want to go for the labor ward prioritization and the surgical steps. I'm thinking just because need to revise like breech and cystoscopy and laparoscopy, these things just to revise today.
Yeah. So see, if you guys just give 30 minutes to all the labor ward prioritization notes, at least your one station is done. Let's be organized for last 2 days. Okay, at least one station is done. Then do the surgical steps like hysterectomy, abdominal hysterectomy, vaginal hysterectomy, laparoscopy, cystoscopy. So at least one surgical step stations would be done, right? After that, I suggest that you guys do or be organized in the revision for the last 2 days. Do the emergencies. Out of that, shoulder dystocia is very important, and the breech is very important. Your forceps and vacuum also go through that. Forceps just came like 2 exams back, so forceps is important. These would be the practical stations. At least you won't be blank, so at least one more station would be done. When it comes to the antenatal and maternal medicine, they always give one station, so that has got a set pattern. So just revise the outline of the temp of all the modules. What would be the history points of subfertility, history points of maternal medicine? Even if you get a new station, like they always give some sort of like malaria was new this time, but you're not blank. At least somewhere in your life you've heard something about that. So don't worry, like coarctation of aorta was this time a new one. So if any new station comes, at least you won't be blank on this. Somewhere in life, something you have discussed and thought about this. So just follow the general template of this. Chin, what do you say on this?
Yes. Again, like for example, the templates were beautifully given and drawn for you by Dr. Tamina and Dr. Sidra Ali. So basically, even if, let's say, the topic that you get in the OSCE circuit is something very unfamiliar, don't panic. Just go with the first instinct and always think back about the template. Say something from the template, because you may have not known hemophilia. You may have not known von Willebrand disease, for example, but go with your first template of the maternal medicine template, and you know what you would say in the preconceptual, what you would say in the antenatal, intrapartum, postnatal, and you will still not lose too much of mark, even if you don't know that disease or pathology in particular.
Exactly, yeah. So what I want now is that, see, as Noreen had her commitments, Inas, you've got a very, very busy hospital, and everybody is busy somehow. We can never be 100% sure of our preparation. It's pretty natural to feel this way, that we had more time, we could have done better, or there's still so much to revise. These feelings are so natural. But I would just like to tell all of you that this is a doable exam. The results would show you that generally the comfortability, the atmosphere is quite comfortable. And I would just request that don't get overwhelmed and there should not be any palpitation. Because in OSCE, when you don't have a control over your heartbeat, you start fumbling. The idea to meet you guys today is that you've been through lots of exams in your life, and we are at the point that we cannot leave the other chores, or for that matter, hospital duties or some household responsibilities, and just sit for this exam. So whatever you've done your best. Again, if something is missing out of those 30 days topics, which are the 5-6 years recalls, and doing the recent 2-3 exams, last year exams, they should be on your tips. If you take out, like, start from today and tomorrow you've got a day, by evening tomorrow, stop studying, please. But by this time, ensure that you keep people do a quick recap of all these things, and everything would be fine. You people would see that something somewhere in your life you have discussed, some patient you have seen, something would come into your mind. But the only thing is that you should be able to speak it. You should be able to reproduce that. That's my concern, and that's what you people have to prove yourself to be. You all can do it. Just go through the notes once again for these 2 days, and just follow the template. Okay, these 5-6 stations done. All right, one station is done. Be organized and focused in your revision, and we would definitely be praying for you guys. All right, so with this last minute booster, please ensure that you guys have a good sleep. Inas, are you having an off tomorrow, or is it like again hospital?
No, I'm off today and tomorrow.
Okay, that's perfect. So at least 2 days they had mercy, huh? Yeah?
Inshallah.
Inshallah. All right. So take good rest before just ending up your, last day for the Saturday people, Friday. Priyanka, when are you reaching? Priyanka, when are you traveling, my dear? Priyanka is there?
No, I
Did she
think
go?
she's locked out.
Okay, she's not there. All right, no worries. Rest, I think nobody has to travel. All are there. Amira, when are you reaching? You have to go from Medina Park, right?
Yeah, I will go, inshallah, Friday morning. And then I will stay one night there. And Sunday I will go for the exam because I can't go same day.
But Saturday is your exam, right?
Yeah. I will go
Okay,
Friday,
okay.
inshallah.
Okay, that's perfect. All right. So please take care of your sleep. And I'm not very sure, Noreen, would they be providing some snacks or something? Any news from the nearby?
Sorry, I couldn't hear.
Any sort of a snacks or something they're going to provide? Any
In the email, they mentioned that you need to bring with yourself.
Okay, that's perfect. So that's not going to be anything they're going to provide. So food and everything you people are going to take. Yeah. So take your water, take your food, and any sort of a snacks which you people think is going to, in the waiting time between the cases and the circuit. So you people can take that. All right. So thank you so much, Chin. Some last few words for your students. Tahmina, some last few words for your students, please.
Yep. Tamina, go ahead.
Yeah, Tahmina.
Okay. So good luck, all of you. And I hope you can do it. I have full faith on you that we can do it very well. So don't worry, be relaxed, and go just to do the exam. Thank you.
Yeah, to it. Yes, Chin, what would you like to say?
Prayers go out to all the students out there. Best of luck, safe trouble. Stay healthy, drink lots of water, and sleep enough. That's very important. And we all will be eagerly waiting for all the victory news and all the names on the pass list. And we will also
Absolutely. Yesterday, we actually didn't sleep whole night. It was a Mrcpi Part 2 and Part 1 results day. So it was like a big, emails and messages and all. So we were concerned, and we are here really happy that that day, actually, all the hard work and the sacrifices, they just come up with all these celebrations. So we, all the team of mentors of RFA tutors, we would really be praying for you guys, and will be waiting for all the successful stories. But again, I would just like to request that whatever had it been in terms of your difficult routines, the last moment, give your best. And if 1 or 2 stations in the circuit they go wrong, don't just think about them. Still, you have a margin to pass. Somewhere in between, you're stuck up in the long case. Try to be confident and try to justify what you're saying. You will impress the examiners. Try to be like a doctor. Present yourself like confident and a safe doctor. This is what they're looking at. Just keep all those difficulties which you had been facing aside, and I'm sure that you all would ace it. Thank you so much, all of you, and the ones who are listening to the recording. We would definitely be praying for you guys in these 1.5 days which you guys have, or 2 days for the Friday people. It's less time. So try to do a quick recap of those 30 cases, please. 30 days, all the cases, the long cases and the short cases. If you just go through that quickly, you'll just have a hang of all the points, and they'll be in your short memory. All right. Thank you so much. Best of luck from the entire team of RFA tutors. Love you all. Lots of prayers and hoping for the best. Thank you so much, Chin. Thank you, Tahmina. Best of luck from all the backend team as well.
All the
Thank you. Bye-bye, everyone. Thank you. Love you all. Thank you.